If you're watching this, chances are tinnitus has started taking more space in your life than you want it to. Maybe it's the constant ringing, buzzing, or hissing that makes it hard to focus. Maybe it's interrupting your sleep or leaving you feeling irritable. Or maybe you've just reached the point where you think it will never go away. If you've decided it's time to get your tinnitus checked out, you might be wondering what actually happens at a tinnitus evaluation. That's exactly what I'll walk you through, step by step, so you'll know what to expect and how to get the most out of your visit. And as you watch, you'll also learn what a thorough tinnitus evaluation should include. That way, if any of these steps are skipped, you'll feel confident asking questions and making sure you're getting care from someone truly experienced in tinnitus. Hi, I'm Dr. Julie Prutsman, and I've been helping thousands of patients with tinnitus across the United States for more than 20 years. For many people, tinnitus starts as something occasional, maybe after a concert or a loud event. But when it becomes constant, it can impact your focus, sleep, mood, and even your relationships. That's when it's time to take action. You may have been wondering, is what I'm experiencing normal? Or do I really need to get help? Or maybe you've thought, there's nothing anyone can do for me. These are some of the most common thoughts people have before they walk through our doors, and I can tell you that's not always true. The reality is, not all tinnitus evaluations are the same. The testing, the time spent with you, and the depth of the conversation can vary greatly from one provider to the next. And that's important because the quality of your evaluation directly impacts the quality of your treatment plan and ultimately your results. So, in this video, I'll show you exactly what a thorough tinnitus evaluation should include, step by step, so you know what to look for and what questions to ask, no matter where you go for help. We'll go through the different tests, why each one matters, and how they work together to give us a clear understanding of your tinnitus and hearing health. By the end, you'll know exactly what a tinnitus evaluation should look like, and you'll be better prepared to take the next step toward relief with confidence. So why does tinnitus deserve more attention? Tinnitus is a symptom of change in the auditory system, usually caused by damage to the inner ear. And the sooner we identify the cause of the change, the easier it is to treat. Tinnitus may simply be the result of blockage somewhere along the auditory pathways, such as earwax in the outer ear or fluid in the middle ear. During our comprehensive tinnitus evaluation, we can isolate where the problem or roadblock exists and address these issues head on. And because tinnitus is generally the brain's response to missing input due to these changes, we will show you why the tinnitus is occurring in the first place with our test results. This helps remove some of the mystery about your symptoms and starts the journey towards relief. You may have been wondering, do I really need to address this now? Or if I'm getting by, what's the harm in waiting? Here's what we want you to know. Tinnitus can become a vicious cycle if ignored. It can lead to difficulty with focus and concentration, mental fatigue as your brain works overtime to try to ignore it. Sleep disturbances can occur as it becomes more difficult to fall asleep and/or get restful sleep at night. And even a higher risk of anxiety and depression due to this vicious cycle that can result. Tinnitus may start as a mere nuisance, but its ripple effects can be wide and deep. Unfortunately, the longer it's left untreated, the harder it can be to regain control and find relief. That's why we recommend a comprehensive tinnitus evaluation, even if it's just intermittent. This allows us to catch anything early that can be avoided or changed to prevent it from becoming constant. If you have constant tinnitus already, don't worry. We can still help and treat your tinnitus successfully, but early intervention is always preferred when possible. Catching changes early gives us more tools, more flexibility, and more time to intervene in a way that's proactive, not reactive. Because when we address tinnitus early, we're not just protecting your ears. We're protecting your brain's processing abilities and your ability to enjoy the people and world around you. Real quick, let's address a few misconceptions about tinnitus. Misconception number 1. I've already seen a doctor who said there's nothing I can do. This is the single most frustrating thing we hear from new patients because it's simply not true. It's common to first bring tinnitus concerns to your primary care doctor or ENT. And while ear, nose, and throat doctors are excellent at identifying and treating ear-related medical conditions, they often don't specialize in managing tinnitus from a neurologic or audiologic standpoint. There's a saying in our field, ENT doesn't mean all three. Their focus is often on ruling out red flags like tumors, infections, or surgical issues, which is important, but it's only one part of the picture. When no visible medical cause is found, many patients are told there's nothing you can do, just go home and live with it. That response can leave people feeling hopeless, dismissed, or even afraid. But just because there's no pill or surgery to fix tinnitus doesn't mean there's no treatment. There's a big difference between no cure and no help. Like other chronic conditions such as diabetes or high blood pressure, tinnitus is highly manageable with the right approach. At Sound Relief, our goal is to minimize the brain's reaction to tinnitus so it fades into the background and no longer interferes with your life. Through prescriptive sound therapy and educational counseling, we work toward long-term tinnitus remission, not just symptom management. Tinnitus is caused by stress, so I just need to relax. It's true that stress and tinnitus are closely connected, but not in the way most people think. While stress can absolutely make tinnitus feel louder or more intrusive, it's rarely the root cause. Tinnitus most often begins with a change in the auditory system, such as damage to the inner ear, blocked sound pathways, or a drop in hearing sensitivity. When the brain detects missing or distorted sound input, it attempts to compensate, and that's when tinnitus begins. So while relaxation techniques can be helpful in managing your emotional response to tinnitus, they won't address the underlying problem. Saying just relax is like telling someone with back pain to sit differently. It may help for a moment or temporarily, but it doesn't fix the reason the pain is happening in the first place. At Sound Relief, our approach is different. We start by identifying the source of the change in your auditory system, then work to calm your brain's response to the tinnitus using tools like prescriptive sound therapy and educational counseling. When the nervous system no longer reacts as strongly to the sound, the brain can begin to filter it out naturally, without forcing you to ignore it or just live with it. So yes, stress matters, but it's a reaction, not a cause, and the right treatment goes far beyond just stress management alone. If I just ignore it, it will go away on its own. This is a common belief and an understandable one, but the truth is, trying to ignore tinnitus often makes it feel worse, not better. Here's why. Tinnitus isn't just a sound in your ears, it's a signal in your brain that it's reacting to. And if that signal is perceived as unfamiliar, unpredictable, or threatening, your nervous system shifts into a fight or flight mode. In this state, your brain stays alert, scanning for danger and amplifying the sound as something to pay attention to. It's your biology trying to protect you, but in this case, it's doing more harm than good. The goal of treatment is to help shift your nervous system out of that hyper-alert state and into rest and digest mode, a calmer, more balanced state in which your brain can start tuning out the tinnitus naturally. That's where prescriptive sound therapy and counseling come in. Instead of trying to block or ignore the tinnitus, we introduce gentle, calming sound input and tools that help your brain reclassify tinnitus as non-threatening. When the brain stops reacting to it, the sound fades more and more into the background, and that's when real relief begins. This is all possible due to neuroplasticity and our ability to rewire the brain. Ignoring it doesn't break the cycle, but the right tools, skills, guidance, and support can. I've had tinnitus for years. Nothing can help me now. This is one of the most common and most discouraging misconceptions we hear. We understand why people feel this way. If you've been living with tinnitus for years, it's easy to assume that it's permanent or that your brain is too used to it to change. But that's simply not true. The brain is incredibly adaptable and plastic. In fact, it's designed to learn, rewire, and change throughout your entire life. So yes, You can teach an old dog new tricks, especially when given the right tools and support. Tinnitus treatment focuses on neuroplasticity, the brain's ability to retrain how it responds to sound. Even if your tinnitus has been present for a long time, we can help your brain start to respond differently. Thousands of our patients who struggled for years have experienced real, lasting relief. It's never too late to get support, and it's never too late to feel better. I only hear tinnitus in one ear, so I only need to treat that side, right? It might seem logical, but tinnitus isn't just an ear issue. It's a brain-based response to changes in your auditory system. Even if you only perceive tinnitus in one ear, the underlying cause may involve both ears or the way your brain processes sound as a whole. That's why our treatment approach is bilateral, meaning it addresses the full auditory pathway to both ears to promote balance and better long-term results. Tinnitus is only a problem with my ears. Tinnitus starts in the auditory system, but its impact often goes far beyond that. For many people, it can affect concentration, sleep, stress levels, and emotional well-being. Our brains are wired to focus on what feels threatening, and if tinnitus is perceived as a threat, it could stay front and center. That's why our treatment addresses the sound and your brain's reaction to it. When we effectively address both the auditory system and the central nervous system involved with tinnitus, patients can achieve long-lasting tinnitus remission. If I could just get control of my tinnitus, I'd hear just fine. It's understandable to think tinnitus is the only thing affecting your hearing, but in many cases, it's not the whole story. Tinnitus often coexists with underlying hearing loss, even if that hearing loss isn't obvious yet. In fact, the brain's reaction to missing sound input is one of the most common causes of tinnitus in the first place. That's why part of our evaluation is focused on determining whether hearing changes, even subtle ones, are contributing to the tinnitus signal. By addressing the auditory changes in tinnitus, we can help you improve clarity, reduce the strain on the auditory system, and finally get the relief you've been looking for. Now, let's get into what to expect at your appointment. Your visit will last about 90 minutes and includes a comprehensive diagnostic evaluation with one of our doctors of audiology. At Sound Relief, nothing is ever rushed or off the shelf. We take the time to get it right because no two ears and no two brains are the same. This isn't a quick screening or gimmick. It's a detailed, thoughtful process designed to uncover exactly what's going on and how we can help. Here's what we'll cover. Case history and conversation. We'll begin by listening, really listening, to your concerns, health history, and how tinnitus impacts you the most. If you've been experiencing challenges or if loved ones have commented, we want to understand how your tinnitus affects you the most. If you have someone who would like to join you for your appointment, we would love to have them attend with you and learn more. Number 2, otoscopy, or video ear exam. We begin with a visual inspection of your outer ear and ear canal using a high-resolution video otoscope. This allows us to clearly examine the ear canal and eardrum or tympanic membrane for any visible concerns, such as wax buildup, irritation, inflammation, fluid behind the eardrum, or even foreign objects in the ear. What makes this different at Sound Relief is that you can see exactly what we see in real time on a screen in the sound booth. Patients often find this part fascinating. It's not every day you get to look inside your own ears. And it helps build trust in the process when you can visually confirm what we're describing. If we find excessive earwax, which can contribute to tinnitus, hearing difficulties, or even discomfort, we'll carefully and safely remove it using specialized tools designed for this purpose. In some cases, removing a wax blockage can lead to an immediate improvement in hearing clarity and reduced tinnitus. This step ensures we have a clear view of the eardrum before proceeding with any other diagnostic tests. A clean, healthy ear canal is essential for accurate test results, and it's an important part of ruling out simple, treatable causes of tinnitus before looking deeper. Comprehensive tinnitus evaluation. This is where we gather a complete picture of your hearing health. Rather than relying on a quick screening or a simple beep test, we perform a full battery of diagnostic tests that evaluate how your ears and auditory system function, from the outer ear all the way up to the brainstem. Here's what's included. Tinnitus pitch and loudness matching. This attempts to match the pitch and quality of your tinnitus in a soundproof booth, such as whether you hear a high-pitched ring or a low-pitched buzz, or possibly more than one type of sound. Once the pitch is approximated, the loudness level of the tinnitus is found. These measurements are helpful in determining the type of prescriptive sound therapy that would be most effective for treating your tinnitus. Tympanometry. This quick, non-invasive test measures the movement of your eardrum in response to slight pressure changes. It helps detect middle ear problems such as fluid buildup, negative pressure, eustachian tube dysfunction, or a perforated eardrum. While these issues aren't the direct cause of tinnitus typically, they can contribute to changes in hearing and should be treated medically before we move forward with sound therapy or hearing devices. Addressing these problems first ensures that any tinnitus treatment plan is built on a healthy foundation. Air conduction testing. Many cases of tinnitus are linked to some degree of hearing loss, sometimes so subtle you might not even notice it. By delivering soft tones through insert earphones in a soundproof booth, we measure the quietest sounds you can hear at different pitches. This gives us insight into whether your tinnitus may be related to hearing changes and helps guide treatment recommendations. Bone conduction testing. Here, we place a small device behind your ear on the mastoid bone to bypass the outer and middle ear, stimulating your inner ear directly. This tells us whether any hearing loss is sensory neural in the inner ear, conductive in the outer or middle ear, or a combination of both. That distinction is important because certain causes of tinnitus may require medical evaluation before we move forward with treatment. Speech audiometry. Even if you can hear tones well, tinnitus can sometimes interfere with your ability to understand speech clearly, especially in certain situations. We present spoken words at different volumes and ask you to repeat them back. This helps us see how well your brain is processing speech, both in quiet and in more challenging listening conditions, and gives us another piece of the puzzle when tailoring your tinnitus care plan. Speech in quiet testing. This measures how clearly you understand speech in quiet, like a distraction-free environment. While it may seem simple, it's an important baseline, especially for tinnitus patients, because even subtle hearing changes can make the brain work harder to process sound. That extra effort can sometimes make tinnitus feel more noticeable or fatiguing. Speech and noise testing. Here, we introduce background noise, similar to a busy cafe, a dinner party, or overlapping conversations, and measure how well you understand speech in that more realistic setting. Many people with tinnitus, even those with hearing that tests within the normal range, find this challenging, and the results help us identify whether additional support, such as sound therapy and amplification, could make listening less stressful and reduce the contrast with your tinnitus. Loudness discomfort levels. Approximately 25% of people with tinnitus also experience sound hypersensitivity or an abnormally strong response to slightly elevated volumes. Loudness discomfort levels, or LDLs, determine where sounds of different pitches become uncomfortably loud for someone. These levels are critically important when customizing sound therapy, as we never want a signal to cause discomfort while actively treating the tinnitus. With prescriptive sound therapy, we are able to improve upon these loudness discomfort levels over time and then remeasure a person's LDLs to verify the improvements. All of this testing is done in a soundproof booth with highly specialized, regularly calibrated equipment to ensure accuracy. By the end of the evaluation, we'll know not only how loud your tinnitus is, but where it's occurring and how it's impacting your daily life. This level of detail allows us to tailor treatment to your specific needs and ensure you receive the most effective, personalized care possible. If prescriptive sound therapy is recommended, we'll demonstrate how it works and allow you to experience the difference it can make when tailored to you. Prescriptive sound therapy is typically music-based, like instrumental music, or nature-based, like ocean waves or water sounds. The key to success with prescriptive sound therapy is that it is set to a very low level to be soothing and calming to the tinnitus and not able to interfere with your focus or communication abilities. Our goal is to find a sound to mix with your tinnitus, not to mask it, to distract the brain away from the tinnitus and calm the nervous system's reaction to it. If we can stabilize the hyperactivity in the brain that creates tinnitus, we can get you the relief you deserve. By the end of a tinnitus evaluation, you should walk away feeling informed, confident, and supported. You should expect to leave with a clear, easy-to-understand explanation of your test results, thoughtful answers to your questions, and, if treatment is recommended, a personalized plan that aligns with your needs, goals, and lifestyle. If sound therapy devices or other tools are part of the recommendation, you should be offered the opportunity to listen to a customized sound therapy signal in the office to see if it soothes and calms your tinnitus. This approach gives you a deeper understanding of what sound therapy is and how it could distract the brain away from your tinnitus. In some cases, prescriptive sound therapy provides immediate relief for our patients. Above all, your evaluation should feel collaborative. The best results come from an open, two-way partnership where you feel heard, respected, and actively involved in every decision. It's also worth noting that not every practice offers the same level of choice and education on tinnitus. Independent audiology clinics like ours aren't tied to a single manufacturer, which means they can explore a wider range of treatment options to find what truly works best for you. At Sound Relief, our belief has always been that an educated patient makes a better patient. We want you to fully understand the neurophysiologic model of tinnitus so that you can take control of your tinnitus and experience life-changing results. Relief from tinnitus isn't just about reducing a sound. It's about reclaiming peace of mind, improving your focus, and restoring the quality of your daily life. A thorough tinnitus evaluation performed by an expert is a critical first step toward that goal. If you're in Colorado or Arizona, we'd love to meet you in person. And if you live further away but aren't ready to make the trip, we also offer virtual consultations. These sessions can give you a clear understanding of your options before you decide whether to travel for in-person care. No matter where you go for help, make sure your evaluation is thorough, personalized, and conducted by an experienced audiologist who truly understands tinnitus. You deserve answers. You deserve options too, and you deserve care that's tailored to you. If you found this video helpful, please like and subscribe so more people living with tinnitus can find the information they need.